What should patients know about uterine cancer?
With respect to uterine cancers, which is broadly classified into two types. One is the endometrial cancer and the cervical cancer. The common symptom that the person comes with is bleeding. So in case of endometrial cancer, generally it's a post-menopausal bleeding that we encounter. Patients above 55 plus or 60 plus. In case of cervical cancer, it is generally in the third and fourth decade, or let us say fourth decade, more commonly associated with whitish discharge, foul smelling discharge, and it could be bleeding in between the cycles, something called as intercyclical bleeding, severe bleeding, pain associated with bleeding, or pain prior to bleeding. Yes, do understand that this overlaps with some of the regular gynecological symptoms, but yes, considering the age and the duration of the bleed, one has to definitely consult her gynecologist, who will evaluate her further with some basic tests like pap smear and other things. So a simple smear, if it detects something at the precancerous level or a early cancer level, definitely the outcomes would be very good. Because in country like India, even now we see a good number of both endometrial as well as cervical cancer. Yes, the number is definitely decreasing, but still we do have a good number that is as walk-ins into our clinics. So cervical cancer, if detected early, has a very good cure.
To add to that, so as you rightly said, whenever after menopause, that is more than 1 year after the periods have stopped, even if there is one episode of bleeding, it is always prudent to get it checked by your gynecologist. Don't think, okay, it's a occasional bleed and we can wait on it. That is a hallmark sign of an endometrial CA. Maybe it is not, but if it is, then you are missing a golden opportunity to pick it up early. That is a primary thing I would like to say. And there usually won't be any symptoms for it. Apart from this bleeding, there won't be any other symptom in an endometrial CA. Again, uterus, it's a funny organ that each part has a different treatment. If it's a endometrial part of CA, the primary treatment is surgery, with others being an adjunct treatment. Whereas if you come to the lower part of the uterus and you come to the cervix, then the cervix cancer is usually a virus mediated cancer, and right now we have fantastic vaccines for it, which if given to adolescent girls can eradicate this cancer, and it should be advocated and promoted to all young girls so that we remove this cancer permanently. What was India's #1 cancer in the man. So these cancers are seen more in, as you rightly said, in the younger woman with all those symptoms. So again, it should not be neglected. It's a urinary infection and not be delayed. You should immediately go to a gynecologist, get the checkup done. Its pap smear and HPV testing is done, and it can be treated. For a lesion to turn from pre-cancer to cancer, it takes 3 years. So there is plenty of time to pick it up early and avoid a cancer from coming. So this is the main thing that I would like to add to whatever he said. Thank you.